Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
According to the World Health Organization, nearly 50 million people around the world suffer from dementia. That is, loss of memory and other mental faculties. And almost 10 million new cases of dementia are diagnosed every year. So this is a serious problem that's not going away. Dementia, it really isn't a specific disease, but rather it describes a group of symptoms affecting memory, thinking, and your social interactions, social abilities. And these symptoms, taken together, are severe enough to interfere with daily living.
But we do have some positive way we can look at this.
I'm glad you do, because we need it.
Lifestyle choices throughout your life may help you cut your risk for dementia. Here to discuss dementia risk is Mayo Clinic neurologist Dr. David Knopman. Welcome back to the program. It's nice to see you.
Thank you for having me.
Dr. Knopman, good to have you on the program, especially when it seems like there's some good news about dementia. We know that lifestyle choices have a lot to do with your health, and now there's pretty good evidence, or maybe it's been longer than maybe it's not new evidence, that lifestyle choices affect your whether or not you're going to develop dementia.
Well, that's right. And there are a number of different activities or diseases, the activities to partake in or avoid and diseases to avoid that make a difference in terms of dementia risk. Interestingly, the main ones are the same ones that affect cardiovascular health: avoiding diabetes, avoiding hypertension, avoiding hypercholesterolemia, not smoking. And then on the positive side, exercising, eating prudently, and avoiding obesity. And these that are called the Simple Seven by the American Heart Association have been shown to improve cognitive health in later life. But these are things that really have to be adhered to beginning in early life, or at least in young adulthood and by midlife. Whether it makes a difference if you didn't do those things in midlife to start doing them in late life, whether it makes a difference or not isn't clear. But for example, avoiding diabetes and hypertension has a really big impact on reducing the rate of dementia in later life.
Because, so what's good for your heart is good for your head.
Well, what's good for your heart is good for your cerebral blood vessels as well, and therefore good for your head.
Yeah,
exactly.
Okay.
Yeah.
So, and it sounds like it has to do with blood flow, blood supply.
Well, it has to do with blood vessels. I think it has to do with the health of blood vessels. I don't think it's just a blood flow problem. It's hypertension and diabetes damage the inside lining of blood vessels, the endothelium, and that in turn leads to metabolic changes and or changes in the blood vessels that have pathologic significance.
One of the first items that is on this, what they've got it broken down into early life, midlife, but the early life one is education.
Yes.
Was this the article in Lancet that you're referring to?
Yeah. How does education make any difference?
Well, education turns out to have a huge impact on later life cognition, and there are numerous studies that have looked at this. It happens to be something I'm very interested in myself in our research. People who are better educated, and it sounds maybe biased, but this is just the way the biology looks, is people who are better educated have brains that have more nerve cells or more synapses, and it makes connections yep. between nerve cells. It makes them better able to live with damage that accrues from disease or from age, compared to people who had lower educational attainment. It's a very strong and consistent effect that's seen in all populations.
Is this why we're often told that we should try to do puzzles and things like that throughout our life? Or should we all be going back to college when we're in our 40s and 50s and 60s?
Well, it probably is much more complex, and education is a proxy, means it stands for good childhood health and probably good parenting, but also so it does reflect using the brain and continuing to use the brain through one's entire adult life is very important. But I think that the data suggests that the most important effects occur by young adulthood.
But you're not suggesting that it's too late to change your
No,
lifestyle
that's
later
right.
on. Yeah.
Right.
And now, when we think of dementia, most of us immediately think of Alzheimer's disease, but there are different kinds of dementia, right?
That's right. So dementia, I more or less like the way you said it when you introduced the topic. Dementia is a syndrome that means that a person has difficulties in daily life on cognitive grounds. And that can be due to many different causes. Unfortunately, or fortunately, whatever, it's a reality that many people use the word Alzheimer's disease synonymously with dementia. And that's a mistake for several reasons, because as you said, there are many different causes of dementia, in our lingo, many different etiologies of dementia, such as cerebrovascular disease, which is probably what we were talking about with these risk factors.
That means the blood vessels that
Blood
feed the
vessels,
brain.
yeah. Stroke, if you will.
Sure.
But Alzheimer's disease is a specific disease. And there are many of us who would rather that term be applied only to people in whom that specific cause is proved. But most people use the word Alzheimer's disease synonymously with dementia, and that can get you in trouble in certain conversations.
But you said that specific cause for Alzheimer's. We don't really know what causes Alzheimer's, right? Or are you talking about the changes in the brain?
Well, we actually know a lot about the biochemistry of it. We don't know exactly why it starts in most cases. We do know in some where it's genetic, but it's a relatively small fraction. But we know a lot about the biochemistry, and I do need to say that over the last 10 years, there's been a real sea change in our understanding of Alzheimer's disease because of the availability, especially of imaging, PET scanning biomarkers, where we can look at the disease in real time in living people and understand what's going on. And it's been a real game changer as far as the field is concerned.
How are depression and social isolation related to this conversation?
Really much more generally, and those are very important. In people who are at risk for cognitive impairment, so we're mostly talking about people in later life, someone who's depressed is going to have greater cognitive difficulties, even if they don't have any brain disease, just because they have difficulties with concentrating, they have problems with mental focus, they're easily distracted. And if you then couple that with even a mild dementia due to Alzheimer's or due to stroke, it's going to make their symptoms all that worse. Social isolation is really also very important, especially for people who are in the beginning stages of the disease, because it makes the symptoms worse. So what I tell people and tell families and tell patients not only is to keep yourself mentally stimulated and physically active, but avoid social isolation and do go for things that are socially engaging. That helps the brain, it helps mood, it helps social interactions.
All right, so I have some friends. Be good to your relatives, Tracy, because you want to have somebody to interact with in your life. Thanks so much for being with us, Dr. Knopman.
My pleasure. Thanks for having me.
We're going to take a short break. When we come back, we'll learn about treatment for the heart rhythm problem, long QT syndrome.